Hello, my name is Dr. Ecker of Allegheny Physical Medicine, doctor of chiropractic here for the last 20 years. The condition today will be the wrist. There's a lot of different wrist complaints. From making a determination of the wrist, you have to first of all figure out what an anatomical part that the patient's having problems with. You can take a look here that there's a lot of different bones in the hand, and then you have a lot of bones in the wrist. These are called the carpal bones. One of the most common conditions that people hear about would be carpal tunnel syndrome. And then what happens is, you can take a look here, this yellow structure here goes through a tunnel. That's why they call it the carpal tunnel. And then you have the vascular supply, and that's why they can get numbness in the hand, or if it's a nerve, it's more burning pain and tingling into the different fingers. If it's the first 3.5 fingers, that's usually the median nerve, and the last digit and a half would be the ulnar nerve. So that would help us determine where that compression of the nerve is happening from. But the interesting thing with carpal tunnel, just to mention, is it can also be pinched in the elbow, the shoulder, or also in the neck. So that's why a complete, thorough chiropractic examination to determine where the problem is coming from is important. A couple other common conditions would be tenosynovitis, de Quervain's disease, wrist sprains, and subluxations. Anytime you have a misalignment, say for example on one of these carpal bones, the most common one may be either the capitate or the lunate, and just by creating a little bit of motion and adjusting those bones and mobilizing will help dissipate that pressure and get rid of that pain and inflammation in that area, and then the patient will heal from that point on. One of the things, orthopedic tests that we perform to find out differentiated diagnosis, a lot of times you'll see patients, they'll come in here and go like this, and then what you do is we have them hold that for 1 minute, and determining how severe the problem is will determine how bad the carpal tunnel is. If they have pain immediately, then it's more severe, but if it comes on after, like, say 15 seconds, then it's not as severe of a problem. And then you go through wrist ranges of motion, and you can help determine what's going on with the wrist, and then you turn it in and out, and then you can also have them grab the thumb and then just go down like this. And a lot of times there'll be some tendinitis, also called tenosynovitis, right in through here, and that's a common condition that we do treat. So the most important thing is to find out if there's any if there's any misalignments in the wrist, and then what we do is we go ahead and correct those problems, adjust them, create some movement in that area, and a lot of their times that their pain does go away. One other thing that we do treat with carpal tunnel syndrome, it's called B6 niacinamide. We've been using standard process since 1929, and we have very good results with that, and they take 1 pill 3 times a day. What B6 does is it acts as a diuretic. It helps get rid of the extra fluid and swelling in that area, and it works effectively.